group of patients. So it's helpful. Make sure you follow your follow-ups with us and follow with your primary care, okay? Please, because as you lose weight, your requirements for your diabetic meds change, for your blood pressure changes, and most of these can be weaned down. Don't assume that you need to continue. As you get less and less weight, hopefully you can get off the blood pressure, the diabetics, all of those things, and your primary is the person to control and help you facilitate that. Of course, we will guide you, but we need them to, on a routine basis, monitor that. And so I always kind of encourage you to follow up with your primary at some stage after surgery. Now, let's talk a lot about these supplements a little bit. There are many. You can get them online. You can get them in stores. The ones that we point out to you are perhaps the ones that have been around longest, a little more well recognized. Don't have to get these, but they are better quality, but we have no vested interest in any of these, so you have to kind of test them out for yourselves and find out what you like. The Bariatric Advantage is one of the companies. I think the brochures or the information is in your handouts. Celebrate is another one. The chewable multivitamins, patients ask what dose of zinc, what dose of this, what dose of that. No. I mean, these are all standardized according to daily requirements. And you look at them, they say 100%, 150%. So your ideal intake should be around 200%. So that's why we always ask you to take double. So 2 chewable multi or 2 capsules of the liquid. The B12 is 1,000 mcg micrograms per week. Now, the absorption of B12 is a little tricky. If you take it by mouth, i.e. if you swallow it, it goes into the gut and it gets absorbed, and things that get absorbed go through the liver, and B12 then gets taken up and doesn't get to the tissues. So if you take B12 by mouth and ingest it, swallow it, you have to take it once a day. If you put it underneath your tongue, where it gets absorbed straight into the bloodstream and doesn't go through the gut and through the liver, it gets taken by the tissues. You can take it once per week. Okay? If you rather do it as an injection through your primary, that's absolutely fine. You have to do it once per month. But no matter what route you decide, you have to take it. And the once per week is probably the easiest. You just remember Sunday or whatever day is your B12 day, and you take one per week. Now, some of you find it gives you a little boost of energy and you want to take it more regularly. A couple of times a week is fine, but don't take it every day. It's high dose. It will irritate you in the sense that it will make you very hyper, jittery, and you won't sleep well. So just take it once or twice a week. The calcium, you start at 30 days, and your goal is about 1,000, 1,200 milligrams. That applies across the board, males and females. And calcium comes with vitamin D. Now, there has been some studies recently in the last month or so that have come out and looked at particularly bypass patients. After first year, they're finding that they're a little bit more prone to bone density loss. So very important, particularly, to make sure that in order to avoid and prevent osteoporotic changes, to maintain good source of calcium, good source of vitamin D every day. Don't miss it. And the calcium comes in many, many varieties. It comes as chewable, comes as the chewies, which I think are in your packets, comes as powder. Find the one you like. The calcium citrate is better absorbed. The calcium carbonate is not as good absorbed, but you can take it. The citrate is harder to find online. Typically, like Bariatric Advantage, you can get it. Carbonate is much more readily available. CVS, Rite Aid, Walmart, Costco, they all have it. If you taking the chewable, look at the dosage. Typically, they're either 400 milligrams, 500, or 600. So aim for 1,200. So you have to take 2 or 3 depending on the actual dosages. If you're taking the chewies, they're 250, 500, or 600. So again, find out. You don't assume, okay, you told me to take 3 calciums, to take 3. You got to find what the dosage individually is. The powders are typically 600. So find what it is and match it up to 1,200. The vitamin D, your goal, ideally maintenance, is somewhere between 1,000 to 2,000 units per day. If you take 3 calciums, each one carries between 400 to 600 units of vitamin D. You will get 12 to 1800. That's pretty good. But we check your vitamin D levels, and if it's not adequate, we'll always add supplemental vitamin D on top. Iron, if your iron levels are low at the 3 months, we will tell you how much you need to take. And as I said earlier, you don't take calcium and iron together. You have to separate them by about an hour. Okay? Biotin for your hair, 1 to 5 milligrams per day. The tablets are 1 milligram. You can take anything between 1 to 5. If you choose the capsules, they are 5. Open the capsule and take the capsule. I mean, you can have ground meats weeks 4, 5, and 6, but the red meat steak, because it's very difficult to break and pulverize, the stomach and the pouch need a little more maturity. About the same, yeah. 3 months we can have, but again, not too dry and chewed really well. So it's got to be dripping with juices, nice and soft. With the weight loss comes the resolution of a lot of the comorbidities. So it's not that one does this to just look different, it's that you are doing this to be healthier. And when we had the support groups earlier, this was one of the things that really was emphasized. So you have to recognize that if you decide to have surgery, it really should be to be healthier, not to look a different look that may, of course, follow. But you just want to go in with the right understanding for the right reasons. The quality of life things are all things that follow after. The fact that you have ease of access, getting in and out of places, going on rides, playing with the kids, running chores around. And these are things that on a daily basis, in fact, just a patient of mine yesterday in clinic was telling me, it's been 20 years since I've been able to cross my legs. And she was laughing. So I didn't even think about it, but I really did cross my legs and I loved it. So I mean, things that are basic things, or you can bend down to tie your shoelaces, and things like that, that we take for granted, are things that become very important. And of course, after this becomes a quality of life issue. Now, the conventional methods, of course, are always there, and they're always going to help. It's not that they don't help. What is important to recognize is that they are not sustainable. So you will lose weight with cabbage soup diet. You will lose weight with citrus fruit diet. You will lose weight with aloe. You will lose weight with phentermine. You will lose weight with exercising. All of those things work. The problem comes in that over the course of 5 years, when you follow these patients, the success rate goes down to about 2%. So 95 to 98% regain that weight. And so it's a combination of reasons why that happens. Of course, patient gets older, the metabolism slows down. It's very difficult to be so regimented in eating so meticulously and exercising so meticulously. And so people have, as time goes by, a little more complacency, and they can start to put weight back on. And with drugs, you can't stay on them indefinitely. I mean, they have side effects. So the reason why surgery plays an important role here is that it gives the person a tool to be able to keep that weight off. And how it does that is because you are going to be more restricted in your intake, you can't indulge in other things that you would have if you had not had that surgery. And it will limit your capacity to fall off track. However, it can still happen. So it's not that everybody who has weight loss surgery will keep the weight off indefinitely. We know that long term in studies up to 18 years, still about 50 to 60% weight off is maintained, but that's way better than the 2% at 5 years. So if at 15 to 18 years you still have 50%, 60% weight off, clearly you're better, but it's not 100%. So you've got to recognize that this is not a magic bullet. It's the best we have, but it's not everything. And it's going to take hard work. And this was another topic. People often comment to patients that you're having the easy way out. And really, it's not. It's probably the hardest way out because we've tried everything else. This is really the last resort in some way. You've got to recognize that it's going to take a lot of work. It's not just surgery done, finish, you're going to lose weight. You really got to watch what you eat. You've got to keep active. You've got to be on vitamins committed for life. And as long as you understand that and you work that into your life, then you should do very well. So if you want to get the full benefit of it, you want to make sure all of these three components of this puzzle are there. The surgical intervention, the tool, the eating habit, lifestyle changes correctly, and the exercise. Each of them pretty much carries a third of the success story. So if you don't do one and do the other two, your percentage success drops by 20-30%. Tissues do stretch a little bit, but they will never stretch to a level where you can have 30 ounces. So what happens is that they get into a habit of eating unhealthy. And a good example is like 5 years ago, so I had a patient that was referred to us who had had surgery 10 years prior, had lost 150 pounds, had gained everything back, and she was referred because she wanted to make sure that pouch hadn't been checked. Of course, the pouch has not, and we checked that. But the first thing that I asked, and she told me, was I asked her, what was breakfast today or yesterday? So she said, well, I start pretty much every day with 5 donuts. You know, so you can see from the very get-go, she got into a habit where it wasn't a concern. She wouldn't dump on it, and she was able to munch on this slowly over the course of a couple of hours, and so she would end the day with 3,000 calories. And so gradually she put the weight back on. So with all of these we can. And that's a very important thing to recognize, because you've got to always be on, you got to have your finger on the pulse. Really.